Let me first exit full screen. There's still. Okay, if I do this, can you see me?
Yes.
Okay,
You
I
can
will.
see the.
Okay, I will do this. You can see
Oh
this.
yeah, you're moving.
Okay, I do this.
Move to your left, keep left, one more left.
Yeah. You mean yes, but you can see the screen, right?
Yeah.
This is correct.
Okay, alrighty. So let's do this. Hi everyone. Good morning, good afternoon, good evening. So I was trained in Western medicine and I started to learn traditional Chinese medicine from year 2018. And I was very lucky since 2020. I started to learn modern tongue diagnostic with Dr. Yin. So it really helped me to understand more deeply about the traditional Chinese medicine. Today, my topic is more about what I see on the daily clinical practice and how modern tongue diagnostic help me with each case. So it's more from the Western medicine point of view. So this is a paper in the journal Medical History. In the 19th century, most Western doctors actually look at the patient's tongue. This is a cartoon in Wellcome Library in London. You can see the doctor not only look at the tongue, he also put his finger on the patient's wrist to check the pulse. However, even they look at the tongue, they actually just look at the tongue itself instead of link any clinical information to the tongue. In the late 20th century, tongue inspection gradually diminished its popularity, mostly because there's not much information in the medical textbook to describe where to look, what to look, how you link the clinical information to the tongue. So we all know the first tongue diagnostic book published in traditional Chinese medicine was year 1341. So tongue diagnosis in traditional Chinese medicine has been really well developed. On the other side, in the Western medicine, there's actually only one book mainly describe the tongue diagnosis. That is in year 1888. We all know in all the past over a century, there's no more Western medicine focus on tongue diagnosis. Even in that book, is mainly describe tongue itself, like not much pathology link to the internal organ. So in the old time, you can see you have to draw the tongue picture and to keep it and describe what the main problem and the corresponding treatment. So on the left side, the picture, about the picture is the short description about the tongue. And then on the lower part is corresponding herbal formula to treat this kind of tongue using the herbs. With the universal use of iPhone, nowadays we can analyze the same tongue across the world. Like you're in London, you're in China. Here we all can discuss the tongue right away after you take the picture. So and nowadays it really make the remote diagnosis very easy. You all remember this one, right? The left side is Dr. Yin's the holographic reflection image of the body, and the right side is the internal organ, how it reflects on the tongue. So the baby is the supine position, and you need to remember where the arm, where the leg, where the hip is located. So this is just to give you an example. This lady, I saw her the first time I went to the Pilates class. So she's next to me and she was complaining her neck hurt. So after the class, I said, oh, let me look at your tongue. So I took this picture. So I was telling her, I said, your sleep is not good. You also, you not only has neck pain, you also have thoracic spine pain. Your middle back also hurt. Your lower back is okay. Oh, by the way, you had the breast implant. So she was shocked. How did I know she has breast implant, right? And you can see on the side here, the left side here, especially the left side and the right side, both part is protruding out. And you can also see the color is very, very dark with all the dark dots on both sides. So why is dark? Because the breast implant is a foreign body, right? There's no blood flow. So this is why. So I was teasing her. I said, I don't know other secret. It is so it's just by looking at your tongue, I got all the information. And she said, yes, her sleep is not good. And also I asked her, do you have any family history of stroke? She said her father actually died from stroke. So today I'm going to just review like the common thing we see at clinic from the head, the neck, chest, abdominal area, pelvis, your extremity, and also we will look at the acute versus chronic tongue change, and also how important the tongue color, the tongue coating, etc. Okay, first topic is insomnia. So the common tongue characteristic of chronic insomnia is the tip is flat. But some patients, they are very anxious and very stressful. So you also will see the arrowhead shaped of the whole tongue. And also you see a lot of red dots and the tip is very red due to the anxiety. From Western medicine, the mostly reason for insomnia is stress, anxiety, and poor sleeping environment, poor habit, and also some mental health condition. You can also have insomnia due to your physical condition, and also certain medicine also can cause you insomnia. Okay, this is a 44-year-old male. He has a very horrible childhood. His mom actually committed suicide in front of him. So you can see his tongue tip, there's a lot of red dot, and the shape is like an arrowhead. So this suggests his anxiety, and also on the tip, it is flat. That show the insomnia. This is a lady, 56-year-old. Her husband passed away 10 years ago. So since then, she was not able to sleep, and she also started to have drinking issues. The left side is year October 2021. So that is the first visit she started to see me, and then you can see the tip is very, very flat. That is, suggests his insomnia, suggests her insomnia. And then the middle one is actually almost 2 months later. So she finished the treatment by after 2 months, and you can see the tongue shape change, the tongue color change, and all the cracks change. So she was able to sleep well. She also totally quit drinking. And then the right one is actually almost 2 years later. So she came back for something else. You can see her sleep is still very good, and the tongue shape keep to be like this instead of with a flat top. And this is a example of headache. So if you look at the headache, most people, the tip is red with those red dots. This is a 15-year-old boy who had a concussion 9 months before his first visit. So he has a lot of pressure sensation, also feel dizzy, especially after exercise. So the left side, you see the tip is very red, even like a purplish around the tip. And also you see the midline, Dr. Mao, Dr. Yin, and Dr. Sun all talked about this. You can see the midline is curved, is not straight, right? This suggests his spine is not straight. There's some sclerosis. He's very skinny, but he was doing a lot of weightlifting. So the muscle is not strong enough to support the spine. And that caused his spine actually curved. On the right side, this is May 29th. This is July 10th. So about 1 month and a half after the treatment. So I asked him to stop weightlifting, do a lot of stretching, and pay attention to his sitting posture at the school. And you see his headache is basically gone, and you can see the tip. And another thing is you see the spine, the midline is much straighter. Now we move to the neck and the back, just like what we saw in the previous case. So the midline of the tongue, if you see a crack or protruding area, it suggests that there's some pathology either for the spine or the soft tissue that around the spine. Especially for those chronic issues, you will see more of the crack. But the case we saw early, he's young, and this is pretty recent, so you don't see the crack yet. So the midline is all the midline bend is you see in sclerosis some dislocation, semi-dislocation with the spine or the muscle or fascia, the tension cause the electrical pole, right? If it is tilted to one side, it means that one side the tension is higher than the other. And by looking at where the location, you can get an idea, is it the cervical spine, the thoracic spine, the lumbar? You can know where is the pathology, and you will also do corresponding examination on the patient. This is a 61-year-old patient with chronic insomnia and severe neck pain for 15 years. So he actually feel a lot of brain fog with the neck pain. And in the past 8 months, it really affected his sleep. On the left side is his first visit. This is March 11th. You can see the neck is, this area is very tight, and it's like the muscle, like a kind of cramps. And also you see he also have lower back pain, and you see the lower back is also with a big crack. And then this is the color is purplish. This is May 21st, 2 months after the first visit. And you see the neck pain is basically resolved. He still have some like a sleep issue, but you see the neck part is much relaxed compared to before. And the right one is after another 5-6 months, and you see the color and the shape is much better, and his sleep started to get better too. This is a 70-year-old lady with chronic sclerosis. She had from T9, thoracic 9 to S1. She has the fusion, and you can see from the right side, the X-ray, the fusion is from the T9 to S1. You also really see it's still very curved. So the direction of the spine is actually the same as the tongue. You can see the tongue, the spine tilted to the right. You can see the midline. That crack is also just as a mirror of her spine. This is an interesting case. This patient, one time during her visit, I saw the left side with the coding. You can see the midline is here, and the coding is just on the left side. So I asked her, anything wrong with your left side? And she said, because it's right after holiday, she said she was lying on the sofa in the wrong position too long, and she in the past. From yesterday, she started to have the left side lower back and the middle back pain. And you can actually is clearly, the coding is in the lower back and in the middle back. And next time when she is back, the left side back pain is gone and the coding is gone. Okay, so now we move to chest. So the organs in the chest cavity, the rib or the chest muscle change can all reflect on the tongue. So just remember the little baby on the tongue. So the first top third of the tongue will reflect what's going on in the chest. This is a 58-year-old female. She had a stage 4 lung cancer with also with thoracic and lumbar bone metastasis, and 5 years ago. But very fortunate, she actually by using the genetic target therapy, she also has been cancer-free in the past 3 years. You can see the whole tongue. First of all, you see this tongue is not, you feel something is wrong. This is tongue suggests the patient might have something severe disease. And also you see the crack is mainly on the tongue reflection area. And this is June 29th. This is December 21st. And you see there's the tongue color, the crack is all, and also the tooth marker all getting much better. The tongue is also more symmetric. And that time, she just feel like a normal person. This is a 57-year-old female. She present with severe dry cough. The cough is like a crazy, non-stop, very deep for 3 months. She thought she had a mold in her apartment. She thought she had a COVID, multiple tests, and now those was positive for COVID. So when she stick out the tongue, you can see in the blue circle, you see around here, the inside is red, is like a purplish and protruding out. And so you see something is wrong in the chest. That time I feel, I don't think it's a lung cancer because it's unlikely in the middle, but I really didn't know what's going on. So I sent her to have an X-ray, and the X-ray showed the tumor. So they did a CT the next day, which showed is a 15 times 13 times 7 tumor in the thalamus. And later they had a biopsy, which showed that she had a diffuse large B-cell lymphoma. So she had a 6 round of chemo. 8 months later, she came back for the neuropathy, for the hand neuropathy. And that time she is already in remission. And then you can see that big protruding thing in the chest is gone. I keep the teeth to let people realize it's the same person. So now we move to the abdominal area. The tongue image of a patient with digestive issues, they will show some horizontal or small vertical cracks in the middle and the lower part of the tongue. This is also sometimes help you to differentiate if it is a spine issue or is the digestive issue. And of course, the upper GI problem will be closer to the top, and the lower GI will be in the middle and the lower part of the tongue. This is an 18-year-old girl with severe anxiety. So she started to have digestive symptoms since middle school. So she has, each time she said after eating, she had stomach cramps, she burp, and she has a lot of food intolerance. You see in the circle, this is the upper GI, and you can see there's a lot of cracks, and also it's sunken, and the color is much darker in this area. So, and also you see her anxiety, you see the red dot on the tip, and you see the tip is red. So even without this patient tell you, if you see a tongue like this, you know this patient have the digestive issues and anxiety. This is a 58-year-old female with Barrett esophagus, and she also has pancreatic insufficiency and gastroparesis. She is actually also using Ozempic. She has diabetes too. So her husband is actually a GYN doctor, is a surgeon. So she has been tried everything, but from the traditional Western medicine, but now those works. So she was vomiting at least 15 times a week in the past 2 to 3 years. So with those strong episodes, you see the deep cracks in the upper GI system. So you know the gut, the stomach, the esophagus, and all the soft tissue around it has the pathology, and you can see clear from here. This is a 13-year-old boy. He started to have constipation since childhood, and he also have stomach cramps, and whenever he eats something not right, he will have skin hives. His ear always red, and he told his mom his ear hurt. The mom just didn't believe him. And then that is actually because of his poor gut. He has the skin reaction to different food. So you see a lot of the redness, the whole tongue is red. And also you see the yellow crispy coating. And here, this is a thick coating that show his constipation. And it's also very watery. So this is January 17th. This is May 6th. So after 3 months of treatment, his symptoms is basically went away. No ear pain anymore. No severe skin reaction to different food. This is a 20-year-old girl. She started to have bladder infection since age 3. And in the past 2 years, she had 4 episodes of pyelonephritis. And each time she needed the IV antibiotics for the pyelonephritis. And you can see at the bottom of the tongue, which is corresponding to the bladder area, there's a really very yellow, thick coating. So that showed the chronic inflammation in the pelvis. So the bladder actually like live in a polluted environment, right? All the blood flow, just like we see outside, if it's polluted, it's not clear and it's not healthy. So the bladder environment is really not healthy. That show the chronic inflammation. This is a 20-year-old boy. He was diagnosed ulcerative colitis at age 16. He tried all kind of medicine. So currently, he is on the immunosuppressor and also on the oral steroid. So he had 6 to 7 times bloody stool and also cramps every day, and also very tired. So you see there's a big crack on the bottom part of the tongue. This is corresponding to the rectal area. So when I saw that, I said, "Oh, your pathology, your ulcerative colitis is mainly on the rectum." He said, "No, 2 years ago I had a colonoscopy. Is also the transverse colon and the descending colon all affected." I said, "Okay, let's see." So 2 weeks later, actually, he had a colonoscopy, and the report showed is only the rectum was affected. And for people who have autoimmune disease, most of them is have a lot of stress. So at age 16, I asked him what happened shortly before that. That is when his parents started to get divorced. This is two female, and the left side is a 45-year-old female with heavy period for 3 weeks. When I look at the tongue, I said, oh, you have a fibroid, uterine fibroid. And this is shown in the blue circle. So she went to have ultrasound, which showed she has 2 uterine fibroid. And the right side is a lady present for shingles. And then when I see her tongue, I said, oh, you need to have ultrasound. And she did, and which showed 4 uterine fibroid. Now we move to the shoulder. So you remember the little baby lying down there, the shoulder is on the side. So this is 3 cases. The first one is a 54-year-old male. He strained his left shoulder when he was playing ball with his kids. So this is only 1 month's history. And you see the left side is very bruised. He has a severe pain on the left shoulder and the left upper arm. And you see the color is like a dark bruised. But compared to the right side, which is pink, so you can clearly see the pathology is here. And the second one, the middle one, is a 79-year-old male. And you see the right side is like a blood stagnation, right? So he had right side rotator cuff surgery 15 years ago, but since the surgery, he always feel right side shoulder pain. So you know this is a chronic. This one, on the right side, is a 77-year-old male. So he has chronic arthritis, rotator cuff surgery on the right side 8 weeks ago. So you can, even though the left side is more prominent, the right side also you can see there's something going on. So the right side after the rotator cuff surgery, he's feeling better, but the left side, he has no range of motion. He was the left side, he already had the surgery 20 years ago. And you know, for 20 years, lack of range of motion, the muscle already atrophied. And you see this is dent in for the left side. He actually is ready for the left side shoulder replacement. This is a 77-year-old female with Parkinson. And she is very, very stiff, mainly on the left arm. And you see the whole tongue. First of all, people with Parkinson, they are very stiff. Even their face is like the mask. So you see the tongue, the whole tongue is stiff, and the left upper side of the tongue is very straight and lost the normal contour compared at the right side. So this is show her left arm stiffness. So now we see some relatively acute changes on the tongue. So this is a 70-year-old female. This is a December 13. 3 days later, she eat some nuts and caused she has acute diverticulitis. So she was given oral antibiotics, and this is 6 days after the episode started. She was in severe abdominal pain when she came in. And then, you know, you wonder if this antibiotics works, right? Obviously, it's not the right antibiotics for her. So she was actually, she got new antibiotics, and 3 days, actually, I have another picture. 3 days after that, the tongue got much better, and her symptom is much better too. So you see the acute change when the patient has something ongoing. So this is a lady, 51-year-old. She started to have sclerosis since teenager. So you see her spine is twisted, tilted to the right, and then it in the arthritic level, it go to the left, right? So this is February 16. This is time is 10:40. This is February 16, time is 11:40. So before the treatment, after treatment, we have picture. And then this is a tongue change. This is February 16, 10:34, and this is February 16, 11:42. So this is right before the treatment. When she come in, when patient came in, I normally just take a tongue picture, and then we talk about their condition. And then the right side is right after the treatment. You can see the spine curled, really curled before treatment, and there is a lot of cracks. And the right side, the spine is much straighter, and the crack is much less because the spine is more, the muscle is more in alignment with the spine, so it's not much tension. Then the crack got less. This is February 22nd, 10:22. And this is the same day, 11:10. This is right before the treatment, right after the treatment. And you see her spine is got even straighter, right? And then the second time, the spine is a little bit straighter, more change. You see the tongue is not as puffy as before the treatment. So this is February 16 before first treatment. This is February 22nd after second treatment. And you see the tongue significant change because between the treatment, patient was also given herb for all her conditions. This is a 85-year-old gentleman. So his wife it was my patient, and he had multiple episodes of syncope. He passed out, and he was brought to the ER for 8 times. They did all the tests, all the imaging, and each time told him everything is okay. They have no idea what caused his syncope. So the left side is on his first visit, September 2nd. You can see the tongue color is really like a purplish, like a dark. Even the coating is greenish. So from traditional Chinese medicine, the point of view, you know, the blood is really stagnated. And then this is October 11th, so only 1 month and 1 week, and you see the tongue has a significant change. This is in year 2022. Since that time, he never have any syncope episode, and he continue able to walk 1.5 miles every day. So you can see patient also on, this is a very interesting topic. So a lot of people nowadays, a lot of patient on anticoagulation, right? So this patient is also, because of his AFib, he's on Eliquis, the anticoagulation. So people say, oh, you're on anticoagulation. Should we use the herbs to help with the blood flow? It's definitely should, because even they use the anticoagulation is only make sure the blood don't develop into blood clot. It doesn't help with the blood flow efficiency. So for this patient, we know that after treatment, his blood flow is much better. So I think, you know, even though traditional Chinese medicine, the tongue diagnosis has been for thousands of years. However, Dr. Yin really made a huge impact on this area because it not only incorporate the traditional Chinese medicine, the tongue diagnosis, but also integrate modern medicine knowledge, especially for the anatomy, for the physiology, so that can let us know more about what's going on. Not only just people who know Chinese medicine understand what's going on, just a normal person can understand what is going on. And it is not, honestly, I feel traditional Chinese medicine is much harder to learn than Western medicine. My PhD is in epidemiology, is also much harder than my PhD. So But the Dr. Yin's method really gave me very objective view. What means yin deficiency? What means yang deficiency? What means the qi stagnation? So that gave me like a very intuitive and give me also not only understand you know the local area but also the whole body what is going on. So I think this not only for traditional Chinese medicine doctor, but also for all doctors, you know, even they are chiropractor or Western doctor, you know, physical therapy, they should all learn this method. Of course, there's still a lot to research. Okay, so my lecture is basically finished. If you have any question, welcome to ask me.
Thank you, Dr. Lu. Anyone, if you have any question, please, you can ask Dr. Lu.
殷老师，我有一个问题，就是像您和这些老师讲课的老师，看这个观察病人的那个舌象哈，然后拍照，那这个时间是不是会影响这个舌质的颜色呀？就是时间长了，它的颜色会不会发生变化？一般好像就是如果这个舌肌啊是太紧张了，这个充血啊或者什么的，这个舌肌的紧张度不一样，会不会有影响？我是这个问题。好，谢谢。
就是您的问题，就是说这个病人伸舌头伸时间长了会影响你的拍照吗？
嗯，
啊，
对，
那对呀，所以你当然，我一般呢，我是病人来了第一次的时候，我会拍3张照片。就我一开始的时候，让病人伸出舌头来放松，然后这时候你一定要马上 capture 它，然后完了我就让病人把舌头缩回去了。然后我就说 OK，再来一次，伸舌头放松，你就让他在放松的最大的那个尺度，你就 capture。事实上，然后我会让他再放松，然后我会同样再 capture 一张，然后完了之后呢，我会让他再伸一张，看我照舌底。所以事实上你最后看到你这3张的 picture。差不多，但是有时候有的更清晰一些，就是你会觉得哪一个你认为能够把它所有的 pathology 都 capture 了，这时候我就用这一张。
谢谢。
不客气。
老师您好，想请问一下，就是你那个脊柱侧弯，就是 only 针灸吗？还有没有其他药物？对，像这种效果那么好的。
没有，这个就是针灸药物，我是后来用了嘛，所以当你用了药物，病人的反应会对针灸效果也会更好。因为我的药物，我在上殷老师的课之前是完全不懂中药的，我之前自己学那些在油管上听那些什么，我听完就忘，我就完全不能够。就觉得很纳闷儿，他们怎么能记住这么多药，这些药性啊，走什么经啊？但是殷老师的这个舌诊呢，就直接让你哦，这个药那就是我看到这个舌头是热的，我就要用凉药，那我就知道了这个药的这个药性，而且我这个药主要作用于在哪，我也知道了它相应的走哪一条经络啊，对。
非常感谢，就是
嗯
对，非常感谢，就是你 only 用针灸就把他的脊柱侧弯给他纠正的话，能不能简单的讲一下是怎么针的，怎么
哦，
扎的？
这个还真，这个还真不是，这个我主要是用了那个钱老的竖横的针法，你可以去了解一下。我觉着不大可能把这个整个的治疗完全讲下来，但是你可以去看一下钱德金老师的竖横的针法。好吗？
哦，好，
嗯，
好，好，谢谢，谢谢，谢谢。
客气。嗯。
Can someone please translate all of that into English?
Sorry. Sure. Okay. So the first question asks how can we got one patient stick out the tongue for a long time? How can we get if that will affect your tongue picture quality? So I was for me at least I normally take 3 tongue pictures for the front part and 1 tongue picture for under the tongue. Look at the muscle, look at the blood vessel. Normally I ask a patient relax and then stick out the tongue. When I see, okay, stick out the tongue, then I will say relax. Then I capture right away. Then I let the patient put the tongue back. And then I will do the same thing another time. And then 3 times. Normally this is, unless this patient is really, hard, doesn't know how to stick out the tongue, I will let him practice several times and capture more picture. Then among all the picture, I will choose one that really can show me the whole tongue, the bottom, the front, the whole tongue. If it is relaxed, I will use that tongue to analyze the tongue. This is the first question, how to get a good tongue picture. And the second question, talking about if I only use the acupuncture for the sclerosis. Yes, this is just by acupuncture the first time and then the second time. But between that, I also use the Dr. Yin's method, give patient the herbal formula. So she is asking how to treat the sclerosis. That is, there's Dr. Chen Dejin has, I used his method for that. So he can, she can further got some more information about that, but it's impossible for me to explain how to treat that during this lecture.
Thank you.
Any other question?
I have a
Yeah.
yes, I do have a question.
Uh-huh.
Can you describe a little bit about what percentage of confidence you have when you diagnose a tongue? So when you're using this method, do you feel that
他们有一个
you're
lecture，
70% accurate?
没事，我不需要听，我就是看看构思，我可以。
Okay, so the question is, how confident
你一直都
I
没有
am
和我说话，所以我
when
就
I
听
look
别
at
的
the。tongue? When I look at the
Yes.
tongue, yeah.
So is there some
我是
conditions that you feel very confident and some conditions you're less confident when you look at the tongue to
Yeah.
diagnose?
Yeah, so you never ever assume. So when you look at the tongue, you always some of them you can see, oh, where the problem, but you need a lot of time you need to talk to patient about what the detail, how they feel. So you always combine with the clinical information. So this is an example. I didn't know this. The reason why I look at her tongue. So when I saw this girl in the Pilates class, she was next to me and then she complained the neck pain. I just try to be, I said, oh, you can, I didn't tell her I do acupuncture. I said, you can try some acupuncture. She said, oh, I don't believe it. That made me feel annoying, right? So I said, okay, let me look at your tongue. When I look at her tongue, I didn't ask anything before I tell her you have sleep issues, you have insomnia, you have anxiety, you have neck pain, you have thoracic pain, and also you have breast implant. So this I can tell 100%. But again, you don't do that because you always combine, just like when you see an imaging, you see a CT, you see MRI, you still combine with their chief complaint to look at their clinical information. But Dr. Yin, this is just like a mirror, like what you see. This is you see you also know you actually when you see a tongue, when you see enough, you will know this person's personality. So I'm sure Dr. Yin on the accuracy is much higher than mine, but it give you enough confidence first to say, okay, in which area or which organ you have problem. This is 100%. But for those detail, you really need to combine with patient clinical presentation and try to also get more the detail about what's going on. Did I answer your question?
Yes, partly. Can you describe a little bit about how confident you feel using the tongue to treat, for example, digestive condition, gynecology, musculoskeletal? What's your confidence in those areas? And if you could rate in percentage, like you feel 70% confident or 80% confident?
I think if you talk about diagnosis, I think the confidence is much higher. But if you talk about treatment, I think it depends on my level of the herbal study. So I'm relatively new, but the good thing is about you have the baseline of the tongue, and you have with your treatment, you see their tongue change, and then you know, am I on the right direction? So if not, then you need to adjust the herbs. So, but I think the diagnosis part, the diagnosis accuracy is at least 80%.
Okay, thank you.
You're welcome.
Anyone have any question?
Can I ask another question?
Sure, go ahead.
What are some of your favorite tongues to diagnose and treat? Like, what are your favorite tongue conditions and tongue presentation and conditions to treat?
The favorite you mean which which pathology, for example, like insomnia or gut issue or those kind of things?
Yeah.
I don't
Yeah.
think that I think it's this is what I feel so different from Chinese medicine and Western medicine. So you always treat the whole person. So even you see, so that's why I have no preference if I more like a treat, because even this person present with, for example, with some pelvis issue, you still, if you see the liver qi stagnation, you still treat it. So, and what I feel that it also you not treat like one part, like what Western medicine do. You treat the whole tongue. You want all the way, everywhere is smooth. Then that way, the patient, you don't care about where their problem, and they will heal by itself.
In that case, so which persons do you find that you enjoy treating a lot because you find that they respond well? Which sort of persons can you describe?
Yes, so people who is a believer, right? So so for me, my population is all I will say like 95% is Caucasian. So, but some of those patients they you during the evaluation, you know they are a strong believer, especially some of them have experience with traditional Chinese medicine. But if you see a patient who said, "Oh, I had one treatment before, it doesn't work," then you know this is not the right person. So people who is a believer, and I truly believe the mind-body power, I think those will have good response.
Okay.
Uh-huh.
All right. Thank you.
You're welcome. Any other question?
Oh, sure. I'll ask another question. I really enjoyed the lecture today and the one from the previous week. I was wondering what sort of plans do you have in the future for future lectures and perhaps international seminars? Like what countries are you looking at to go to teach? Can you tell us?
Okay, let me answer this. We'll hold a English modern tongue diagnosis training class. Will start beginning of end of next month, end of October, and each week we'll have 2-hour lessons. So this lecture will be performed by 4 of us. So if anyone interested this training course, you can contact me. And this will last about over 30 hours, over 30 lessons. Will cover all the principles, modern tongue diagnostics principles, the herb tongue correspondence, and herbal and the acupuncture point and acupuncture treatment corresponding with tongue diagnostics. So if you are interested, you can contact me, and this information will show on the website and the Facebook Messenger group.
Okay, perfect. Thank you.
You're welcome. Okay, if no question, the lecture will finish now. Thanks, Dr. Yani Lu, Dr. Haiyan Mo, and Dr. Sun Yun performed the wonderful lectures. And thank you all attend this lecture. Okay, let's say goodbye.
Thank you for joining us.
Thank you.
谢谢
Thank
老
you.
师，谢谢各
Thank
位。
you. Thank you for the lecture.
Thank you.